Today, we're diving into a crucial topic that could literally save lives, the often subtle signs of a stroke. Recognizing these signs early and taking swift action is key to minimizing potential damage and maximizing recovery. We're going to discuss 5 common symptoms of a stroke that can appear even a month before it happens. Remember, knowledge is power when it comes to our health. Have you ever experienced a sudden onset of numbness or weakness in your face, arm, or leg? It's important to pay attention if this sensation is concentrated on one side of your body. This can feel like your arm has gone completely asleep, or like your face is drooping on one side, even if it's only for a short period of time. Now, this doesn't necessarily mean you're having a stroke, but it's a potential warning sign that shouldn't be ignored. Think of it like this. Your nervous system is like a complex electrical grid. A stroke occurs when there's a disruption in blood flow to a part of your brain, similar to a power outage in a specific area. This disrupts the signals between your brain and your body, often leading to sudden numbness or weakness. If you experience this, even if it goes away quickly, it's crucial to contact your doctor or seek medical attention immediately. It's always better to err on the side of caution. Early detection and intervention are paramount when it comes to stroke management. Our next sign involves the brain's communication center. Have you ever felt suddenly confused, had trouble finding the right words, or struggled to understand what someone was saying? These instances can be early indicators of a stroke. Imagine your brain as a bustling control room, with different areas responsible for different functions. The areas that control speech and language can be particularly vulnerable during a stroke. When blood flow to these areas is compromised, it can lead to sudden confusion or difficulty communicating. Now, we've all had moments where we've stumbled over our words or forgotten what we were about to say, but if this happens out of the blue and is accompanied by other symptoms like sudden numbness or weakness, it's essential to take it seriously. Time is of the essence when it comes to stroke treatment, so don't hesitate to seek help if you notice these symptoms. Moving on to our next sign, let's talk about vision. Our vision is precious, and sudden changes in our ability to see clearly should never be ignored, especially if it happens in one or both eyes. This could manifest as blurry vision, double vision, or even temporary loss of vision. Our eyes are like cameras that constantly send images to our brain for processing. A stroke can disrupt this process by affecting the areas of the brain responsible for vision, or the blood vessels supplying the eyes. Transient vision disturbances can happen for various reasons, but when they occur suddenly and intensely, it could be a warning sign of an impending stroke. Remember, early detection is crucial for effective stroke management. Our sense of balance and coordination is something we often take for granted, but sudden trouble walking, dizziness, loss of balance, or coordination can be incredibly disorienting and potentially dangerous. These symptoms, especially when they appear suddenly, can also be early warning signs of a stroke. Imagine your brain as the control center for your body's movement and coordination. When a stroke occurs, the areas responsible for these functions can be affected, leading to difficulty walking, dizziness, and loss of balance. It's like the communication lines between your brain and muscles get disrupted. If you experience these symptoms, it's essential to take them seriously and seek medical attention immediately. Remember, prompt action can make a significant difference in the outcome of a stroke. Let's talk about headaches. We've all experienced headaches at some point, but a sudden, severe headache that comes out of nowhere, especially if it's unlike any headache you've experienced before, can be a red flag. This type of headache is often described as a thunderclap headache due to its sudden and intense nature. While not all headaches are a cause for concern, a sudden severe headache with no apparent cause should never be ignored. It can be a sign of bleeding in the brain, which can be a life-threatening condition. If you experience a sudden, severe headache that feels different from your usual headaches, it's crucial to seek immediate medical attention. It's always better to err on the side of caution when it comes to our health. Outro, remember, recognizing the early signs of a stroke and taking swift action can be life-saving. If you or someone you know is experiencing any of these symptoms, it's crucial to seek medical attention immediately. Don't wait for the symptoms to pass or dismiss them as something minor. Early detection can make a significant difference in outcomes. The faster you act, the better the chances of minimizing potential damage and maximizing recovery. Don't forget to like, share, and subscribe for more health tips and information. Stay informed, stay safe, and take care of yourselves and your loved ones.